think in this week we also got this news that vaccine hesitancy is reaching at its lowest levels since the time the pandemic began in Australia. 90% of the people now feel that they should get vaccinated. There are only 10% of the people who are still a bit hesitant about that vaccination. But I'm quite sure that in the coming days, once they see the benefits of these of getting vaccinated, and once they see that, I'm sure that the 10% will also change. And kudos to some of the councils in Sydney. I would like to really congratulate those councils, including the Blacktown Council and a lot of other councils who have reached a record vaccination rate. I was so surprised and happy to see that councils like Blacktown have reached a single vaccination of 95% and double vaccination of 68%. Incredible job, Blacktown people, and also councils like those, isn't it?
Absolutely. No, that is very, very true. The way that the community has rallied to combat and absolutely do everything they can in the face of the disease is an absolutely admirable effort. It does mean that when freedoms release, when we experience freedoms, we're going to see those suburbs. I expect to see a flip from west to east, actually, of hotspots and whatnot, just because of the vaccination rates. Unless the eastern suburbs pick up the act, I suppose, and match what Western Sydney have achieved, then I expect to see that, unfortunately, there'll be a heavier toll on the freedoms as a result of the freedoms in the east. And I mean, on your comments relating to that 90%, it's as my PhD is in vaccine hesitancy. What a delight it was to see such a high number in this latest survey. I've been conducting interviews for my research in the last couple of weeks, and of course I can't speak yet. The data is still being collected, but I do have to say that the feelings, the sentiments that people who do not want to I've been speaking with people who do not want to become vaccinated, who do not intend to vaccinate. That there is definitely a need for this 10%, so to speak, need special attention, and there are particular concerns addressed. So it will take really tailored and unique public health interventions communicated in a very particular way to really minimize that 10% to 5% and even smaller, hopefully, in the coming weeks and months.